We're for sharing innovative treatments and preventing disease before it ever develops. Learn how our team is working to better care for you on this edition of UVA Health System Radio. Here's Melanie Cole.
For patients with immune disorders and blood cancers such as leukemia and multiple myeloma and lymphoma, stem cell or bone marrow transplants can offer potential cures. My guest today is Dr. Leonid Volodin. He's board certified in hematology and medical oncology at UVA Health Systems. Welcome to the show, Dr. Volodin. So speak first about when would somebody need a bone marrow or stem cell transplant? When would this be considered for a patient?
Thank you, Melanie. Thank you for inviting me to the show. Bone marrow transplant can be life-saving for patients with hematological cancers. As you mentioned, conditions such as leukemia and lymphoma. So, for example, in case of leukemia, many of the non-transplant treatments can achieve cures, but the cure rate is still relatively low for some of the high-risk leukemias. We're talking maybe only 20 to 30% of people being cured with non-transplant treatments. And transplant offers more effective treatment for those type of patients, potentially achieving cure rates of 50 to 60%. So this is one example for conditions such as refractory lymphomas or multiple myeloma. Transplant can also achieve cures or prolong remission rates. So it's important to distinguish two types of stem cell or bone marrow transplants. One is autologous, when cells are taken from the patient himself, him or herself, and then after high-dose chemotherapy, reinfused back into the patient to recover their blood counts faster. And the other one is allogeneic, when a donor is needed, and donor cells given to the patient after, once again, high-dose chemotherapy. In the case of allogeneic transplant, apart from getting the benefit of high-dose chemotherapy, the patient also benefits from the donor cells, which often fight the disease directly in what's called a graft versus leukemia or versus lymphoma effect.
So tell us let's talk about the allogeneic. How are donors found? Is there a database like there is for other kinds of organ donation, or does it have to be somebody you know? To speak about donation a little bit.
For sure. As opposed to solid organ transplant, when one sometimes look at blood group, for example, and donor has to match on a blood group. With allogeneic transplants, donor has to achieve an HLA match. HLA is a group of genes that's located on chromosome 6 that are responsible for how our immune system interacts with the rest of our body, how it sees other molecules and distinguishes self from non-self, for example, eliminating viruses from our body. And so if we transplant from a donor that's not HLA matched, the transplant is very likely to fail. The first source where we go to find a donor are siblings of the patients, because we inherit half of our genes from one parent, half from the other parent. There's a 1 in 4 chance that any one of our siblings may be a donor and be HLA matched. However, if there are no siblings, or siblings are not in adequate state of health to donate, then we would go to an unrelated donor. So there is this, as you mentioned, the NMDP or Be the Match program that attracts volunteers from U.S., North America, and also around the world, and currently has more than 15 million people who volunteered to donate for unrelated people, or patients who need this donation. And so if there are no siblings, we go to the database and compare the patient's HLA type to those of the donors available in the database, and hopefully find a donor that way.
So UVA was recently designated as a National Marrow Donor Program and Be the Match Transplant Center. So speak about how that really benefits the patients that come to UVA for bone marrow or stem cell transplants. Well,
obviously, if before we had access to unrelated donors. We could only find donors among the siblings, and so we had limited number of potential donors. Especially in small families where there may be only one sibling, the chances, as I mentioned, are only 25%. And the average American family, you would probably have a chance of 30% of having one of the siblings being a match. And so this significantly expands the amount of donors that we have access to, and potential is if a patient previously could not have transplant because of lack of a donor, now we're able to find a donor and proceed to transplant, avoid any delays. Previously, patient might have had to go to another center that's further away. Now he or she can come closer to where they live and have a transplant offered to them. Also, being part of an MDP also is an attestation to our ability to provide comprehensive care. We had to match certain requirements, show that we're able to provide comprehensive care for our patients who have 24-hour access to care post-transplant, be able to rapidly access our system, be treated for complications, and also that our program follows certain standards, operating procedures that enable us to provide a treatment in a reliable way and matching a certain quality. So it's also attestation to the level of quality of our program. So both of those ways are beneficial to our patients.
And so, Dr. Volodin, why should patients who need a bone marrow or stem cell transplant come to UVA for their care?
As I mentioned, that those who do need transplant often receive their hematological care at UVA already by regionally and nationally recognized hematologists. And so us adding the transplant part to the options that they have at UVA allows them to stay at UVA and continue their care. We closely communicate to non-transplant hematologists, and so this facilitates us providing the care in an efficient way. This allows us to minimize delays in providing the care. As I mentioned, being part of an MDP attests to the quality of care and the standards that our program has met so far. And I think as a perhaps somewhat smaller program than as compared to some of the big programs, we are able to provide more personable care where our patients get well acquainted with various members of our team who work together well together in close communication. So the transplant is the procedure that's performed by a team rather than an individual, and so we have many dedicated doctors, nurses, transplant coordinators, cell processing laboratory team, apheresis team, and many other professionals, more than 20 people on our team who provide care to our patients.
And in just the last minute, people get a little bit afraid of donating bone marrow. Does it hurt? How is it for the donor itself? We only have about a minute left.
For sure. And as opposed to perhaps previously or older days when bone marrow donation was done through actually doing a surgical procedure, 9% or let's say 95% of donations are done by extracting cells from peripheral blood. A person gets connected to an apheresis machine, which is like a dialysis machine that centrifuges the blood, separating it into layers of cells, and the layer that's rich in stem cells gets extracted while the rest of the blood gets recirculated. So it's a relatively painless procedure, and people from the ages of 18 to 45 are very much encouraged to join an MDP program. There's probably 1 in 500 chance of one actually being a donor during their lifetime, but it's a very worthy cause, especially for people of non-white ethnic groups where there is very much a need for more donors.
Thank you so much. You're listening to UVA Health Systems Radio. And for more information on the UVA Cancer Center, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.